to do this. I think it'll make a huge impact and help us all.
Good to go?
Yeah, you're good to go.
Just open up your laptop and you're set.
Okay. No, I'll just go off of this. So are we good? I have to apologize to everybody that's on this side of the room. You got to deal with this, okay? So just a quick introduction. My name is Mike Isom. I'm a registered nurse. I've been a nurse for, not Mike Tyson, a little bit different, right? Yeah. Almost the same physique, right? Not quite though. So I've been a nurse for 16 years. I got into the toxicology world about 8 years. My brother kept relapsing. And I couldn't figure out as a nurse why, it's just different brains, different schools of thought, different thinking. And it wasn't until I actually visited, so truth be told, I almost failed my psych class in nursing school because I couldn't figure out gray. Everything was black and white. You know, if this is going on, you take this. If your blood pressure's high, you take that. Everything is a decision tree in the medical world, which you guys deal with all the time, right? They just treat. It wasn't until my wife had postpartum depression that I realized there was a shade of gray. And it's also the first time I realized there's no such thing as black and white. It's all shades of gray. And there's no one shade of gray that's good, that's bad, that's normal. There's no such thing as normal. That's what started happening to my mind when I started looking at treatment. I started looking at substance abuse. It wasn't until, and I don't even want to do by the raise of hands. I got to start out by saying, as a nurse, okay, I speak 2 fluent languages, English and sarcasm. Okay, that's what you're going to see up here over this next bit is my brain. Okay. The other thing that I learned over the course of the last 8 years, I firmly believe that people don't go for drugs of choice. They go for feelings of choice. And they will click down to all kinds of different things. And you see it in lab results. So when I start looking at that, this isn't a commercial for any lab, it's just strictly the questions I get all the time. Okay, so I do trainings for nurses, for clinical staff, for judges. I just got done doing a training in Salt Lake for an association of defense and prosecution attorneys to help them understand there's a lot more to drug testing than pass-fail. And when I was explaining them to this is how my mind works, okay? And you guys can agree or disagree. I firmly believe that there are 2 types of patients that you guys are dealing with, regardless of who your clientele is, okay? You're either dealing with compliant or non-compliant patients. They're either taking the meds they should be and nothing else, or they're not, okay? However, the non-compliant group, okay, I believe there's 2 types of non-compliant patients. The first one, okay, they're the ones that don't know the difference between a round pain pill and an oval pain pill. I'm taking my pain pill. Well, are you taking this one or this one? Are you taking your mental health med? Yeah. Well, are you taking your Prozac or Zoloft? I'm taking my mental health med, okay? They're the ones that you can help identify there's reasons. And even though not everyone is here as a prescriber, you guys know why they're on Zoloft. You also know why they're on an antipsychotic, okay? They're prescribed those for reasons. So they're the ones that you can bring back and say, hey, there's reasons you're not on Bob's risperidone, okay? Because everyone shares medications, okay? They're the ones that you can bring back. You can teach them, you'll see them correct. You'll see them no longer taking what they're not supposed to be taking. They're these guys. The second group of non-compliant are these guys. They're flat out lying to you, okay? If they're flat out lying to you, you got to figure how to move them to the first section, then eventually bring them to the compliance side. That's what this is about, okay? Drug testing is a way of looking at objective information. So one of the things that bless your hearts, all you guys can read the room, read a patient, see what's going on. You guys are trained in that. You understand what they're doing, okay? I can't even remember half of what the assessment tools you guys even use, okay? But, and don't destroy me if you guys ride horses, okay? If we were riding horses side by side and I looked at you and I said, hey, something's wrong, As a therapist or as a counselor, as a treatment, you can see what's going on. Something's wrong with that person. They're not safe. You should get off that horse. That's a subjective assessment, okay? How many people are going to get off that horse? And would you guys even get off that horse if someone said, hey, something's wrong, you should get off that horse, okay? However, if I'm riding with you and I look at you and I say, wow, you're breathing really heavy. Your eyes are dilated. Your pulse is rapid. You should get off that horse. Well, as soon as you get off that horse, I can measure all of that. And I can also measure to see if you're getting better to get back on the horse. That's how you use objective, measurable information, okay? Drug testing, one of the things that just pisses me off about drug testing is everything is clumped into a pass or fail, okay? When's the last time you guys went and got your blood work done and you were nervous about failing your blood test? You guys ever done that? Oh man, they're gonna know I ate more ice cream, my lipids are high, you know? I mean, think about it, nobody fails their blood work. It is what it is, right? And then you treat based on what's going on. I have an infection, my whites are up. Well, depending on what is prescribed, if you're taking it, right? No one takes all their antibiotics that they should anyways, okay? But your white count will drop if it's working. It's measurable, okay? Drug testing is one of those things, depending on what type of test you're using, what information you're getting, if you're using it simply as a pass or fail. And let's be honest, okay? Drug testing is not one of those things that's taken lightly by your clients, right? Something's wrong, pee in a cup. You're walking weird, pee in a cup. Quit picking your nose, pee in a cup, okay? I mean, all those things, it's always a punitive thing, okay? I mean, how many people are excited to pee in a cup? And it's horrible, okay? You break that relationship, and depending on what the result comes back, now you got to deal with it, okay? Versus doing what I want to talk about. And again, remember, I'm talking about what you can do with current lab testing. If your lab's not doing a lot of this stuff, find us afterwards and we'll show you who you can, okay? But there's a huge difference between compliance and non-compliance with drug testing. And if you use it that way, a lot of what was mentioned earlier about your clinical outcomes, are you tracking your outcomes? Are you reporting back to the state? Everyone needs more money, right? I can guarantee you, I mean, I've been in so many subcommittee meetings in so many different states. Everyone's screaming for money. Legislators are tired of spending money with no outcomes. They don't know where it's going. It's a black hole. Everyone knows the problem is getting worse, but there's no outcomes, okay? I mean, think about it. If you have a broken leg, would you get surgery 8 times on that? Eventually you say, this sucks, fix my leg, type of a thing. You can't have that immediate fix with the world we're in today, in this environment, okay? But a lot of legislators look at this world as an expense. Everyone wants more money. Give them outcomes and you'll get more money, okay? If you do utilization reviews, I can talk to you, and by the way, you put a quarter in me, I can go forever, so I gotta shut up and stay focused here. But this is data that I wanna share with you that you can use for your outcomes. You can report back to the state, you can report back to the county. This is what we're doing, compliance. There's a huge difference between somebody's information on how they're doing versus they failed. They need to be readmitted, okay? And here's what I want to explain. This is why I call it Toxicology 101, okay? So, whoops. By the way, my daughter, who is a PowerPoint genius, said I got a C- on this PowerPoint, okay? So if you got problems, let Haley know, and she'll tell me how to fix it. So I want to just kind of clarify drug testing, because we say drug testing, well, what is it? That's like saying I need a car. Well, do you need a truck, or do you need a sports car, or do you just need to get there's all kinds of different testing. There's 3 types of testing that I'm going to refer to this entire time, okay? Point of care cup, rapid results, okay, where you pee in a cup, you get a rapid result, or you dip a stick, something like that. The second is called a screen, okay, or presumptive test. Third one is called a confirmation, okay? To clarify the difference between the two, I threw up these little comparisons with pregnancy, okay? When you put, I don't want to get into any, I'm just saying pregnancy, okay? I don't know who's pregnant, who's not pregnant, okay? It's just pregnancy, okay? That's my nurse disclaimer, okay? So when you take that pregnancy test and you put it in the urine, all that does is it looks for a hormone that changes a stripe from nothing to 1 or 2 or something like that, right? But based on that, it says pregnant. The next level of testing is where a woman gets a blood drawn, and then the blood identifies there's enough of the hormone present to say pregnant, okay? Clear difference between the two. Now you know you're pregnant, okay? The third type of testing, or for pregnancy, is like an ultrasound. This is the different quality and information that comes from the different levels of testing. An ultrasound can say when the baby's due, is the mom in danger, okay? Because if it's attaching at the wrong spot, you got problems. How far along? You can measure all this information with an ultrasound. That's the type of difference in drug testing, okay? You can just say pregnant, or you can say September 21st at 2 o'clock and everything's good, okay? That's how much different there is. Now, again, when you look at types of testing, the way that these work, the way that point of care testing works, or those dipsticks work, is there's a chemical reaction that says positive or negative. You guys have all read these cups, right? Right? Is that one line or two lines? Is that faint, or do you see a line? Okay, this is a subjective reading. And who knows how many people that are reading these labs are high too, okay? Okay, this is one of those things where people always say cops are changing the rules because they're interpreting what's going on. Somebody is interpreting this response. This is the horse thing. Something's wrong, get off. You're on fentanyl, get off, okay, type of thing. Now, this is something that happens all the time, but remember, it's a chemical reaction that makes this happen, okay? The second type of testing is called a screen or presumptive test. What this does is the urine then is added to a machine, and the machine adds chemicals to the urine. Then based on the chemical reaction, the machine identifies positive or negative. But again, it's a chemical reaction, okay? Now I'm gonna have fun with this. My sarcasm is gonna go to like 11-teen with this here in the next couple slides, okay? But remember, this is the one test right here that identifies that a benzo is present, an opioid is present, okay? And that's what it does, gives you that information. Third type of testing, confirmation testing. What it does is this is a second machine that actually identifies the molecular weight of the drug, okay? That's where patents come into play, okay? That's why this drug does this. It's specifically a specific compound that the machine then measures. The other thing about it too is on my little slide, every machine has this bell curve. You guys remember statistics, okay? This is not statistics, but there's still a bell curve in this, okay? Every single lab has a cutoff. What that cutoff means is there has to be enough present to cross that line, and then the lab can say positive. There's meth, there's fentanyl, there's whatever else the lab's testing for. Has to cross that line. So when a screen or a point of care cup says positive, there might not be enough to cross this cutoff. That's why sometimes these come back as negative, even though everything else you say says positive, right? I mean, labs are confusing as hell. The only reason I got into labs, I got sick of salespeople coming in to my outpatient program that I was running. I got so sick of labs, the salespeople coming in all the time, that I went off on one of them one time. I'm like, it's a vomit of data. I don't care. Leave me alone. I don't want lunch. You know, all the fun things that everyone does, okay? And one lab came back 2 days later and they said, what would you do different? I said, I'd make this useful. I wish you'd give me the information in a useful way so that clinically we could use the data. We could actually know what's going on instead of just this vomit of pass fail. So they let me do this. Okay, so these are my babies that we're talking about here. There's also another thing called an upper limit. Okay, what an upper limit is, our labs are only allowed to give the information they're credentialed with. Labs have to do a validation process that says we can report between this and this. Every lab's different, okay? Every lab has a different menu of drugs they're looking for. It's like their own chili recipe, okay? Tell me one chili that's the same as the other, okay? Labs aren't the same. However, this is what confirmation is looking for. If the number falls between the cutoff and the upper limit, they can tell you exactly how much of that drug is present, okay? Exactly how much there is. Now, when we say drugs that are present, I'm not talking about half-life, or are they high at this time? Or is it actually, this is how long it stays in your system. Medications, not only do they work and they have an active cycle, it's called a half-life. But once that half-life wears off, it still remains in your system. That's one of the differences with urine toxicology. Your urine is filtered plasma. I mean, urine was plasma 20 minutes ago. Okay, so the difference between urine toxicology testing is your bladder can store that, which gives you a longer detection window. Different labs, different types of testing have shorter detection windows. But this is what I want to go over with you. These three types of testing, when you're doing this or when you're engaged with your clientele, knowing what you're talking about changes the conversation with your client. Okay? There's a huge difference between a real sample that you know what's going on versus, oh shit, I hope this is not right. I know everyone's been there before. It's like, I hope they're not relapsing. I hope, they're losing all this ground. I'll show you different ways to get around that. So there's 3 things that I look for every time a call comes in, or like we go out and we see clients, or we go out and talk with people. Anytime I look at a lab result, there's 3 things that I do. Number 1, is it real? Is the urine real? Okay. The second thing, are the prescribed medications present? A lot of people talked about dual diagnosis. Okay. If someone's on the wrong mental health med, I guarantee you they're not focusing in group. You ever wonder why you have to push someone's tongue back in their mouth while they're in group, and you're charting that they're not productive, they're not participating, they're not, well, look at what's in their system. And why do they got Bob's meds in their system? Because that explains why they're crazy today. Okay? I mean, you guys see things that don't make sense. See things all the time. It's like, why are they acting this way when this med's in their system? Why aren't they acting this way? Because this med's in their system. There's reasons for all these different medications. Okay? So the 3 things that I'm looking at, is it real? Okay? Number 2, are the prescribed medications present? Are they actually taking what they should be on? And the third one is history. This is how you can actually start tracking their outcome. Are they getting better? And I'll go through all those really quick. Okay, so the first one, is it real? I don't recommend this, specifically if your computer is being monitored, but Google how to cheat a drug test. You guys ever done that? Okay, as of this morning, there was 22 point what? What does that say? 24.2 million results on how to cheat a drug test. These are the stories you guys get. Okay? These are the stories like, oh, I got this because of this and because of that, and I was standing next to this person and he licked my thumb and that's why I'm positive. Okay? This is where it's coming from, okay? Everyone talks. All your clients are talking. Have you ever noticed too? Sorry, this is where my sarcasm kicks in too. You ever notice how everything is going great and then you get a new admit like, what the hell happened last night? Because everyone's crazy now, okay? I don't say crazy, I'm just saying crazy, okay? So I want you guys to know how real this is, and regardless of where you are, okay, do these 2 things. Okay, number 1, shop for yourself for these products, okay? Is anyone familiar with the fake urine industry? Right, okay. UPass that's up there on the screen, I bought from Amazon. You know when you buy something on Amazon, it says recommended products that other people buy? The number 1 product that is sold with UPass on Amazon are catheters. You wonder why people have bladder infections? Okay. No one's doing sterile technique, I guarantee that, okay? So you can take this urine, heat it like this, recath it into your body. That way when you do a witness drug test, you're peeing fake urine, okay? This stuff is toxin-free, okay? It's fetish urine, but it's specifically balanced for creatinine, pH, and specific gravity. You can pour this right in and pass any drug test, okay? There's a pain clinic in Salt Lake City, Utah, the biggest pain clinic in Salt Lake City, Utah. Right next door to it, there's a gas station, okay? In the gas station, there's a sticker on the microwave that says, not intended for fake urine. On the microwave, next to the burritos, okay? Okay, buy this stuff, send it to your lab, see if they check it, because when people are cheating and they're actively cheating, they might be hiding something, but at the same time, they also don't want that confrontation of I'm cheating. If anybody's diabetic, don't raise your hand, okay? I would bet, and it's a joke with nurses, okay? Most diabetic patients keep 2 glucometers. One to test all the time, the other one to test when they get a good result. Which one goes to the doctor? Why? Exactly, right? I don't want to hear I can't have donuts. Okay? So the doctor's going, hey, these are great, your readings are good. Then the A1C comes. How in the hell are you at a 9 when your blood sugar is constantly at 12? No, not a 12. That's the wrong number. 110 or something like that. Okay? But that's where you get that conflict of data is like, what's going on? I'm reading the data, but it doesn't match what's going on. When you start looking at this information, and you start seeing what they're actually doing, it changes the conversation with people. And I'll show you that. This is the next one. Have you guys ever heard of detox drinks or cleanse drinks? Buy them anywhere, okay? What these do is that you drink it. The instructions say right on it, okay? Drink it, fill it with water, drink it again. Go to the bathroom, and when you go to the bathroom, you'll have a 2-hour window to pass any test. We've tested these things, guys. You can be lit on heroin and gasoline at the same time and pass your drug test and be clean, okay? Now, in particular, okay, the reason I say do this for yourself, try this out, okay? Go home or here, well, don't everyone go to the same store, okay? Go in and act nervous. You gotta act nervous, okay? And just say, I gotta pass a drug test, what do I do? Okay, and go to a vape store, smoke shop, try one of those, okay, your local shop. Watch whoever's behind the counter turn into a pharmacist, okay? They're immediately gonna say, is it a witness test, is it a non-witness test, how much time do you have? And they're gonna sell you something that will work in that environment, okay? When I was in Oklahoma last November, we were doing a conference and I thought, hell, I'm gonna go to a vape store and buy some stuff real quick. So I walk in and I'm like, hey, I want the detox drink. Lady looks at me and she says, our system's down, we can't sell anything right now. I'm like, what? She goes, yeah, our barcode's not reading. Like, that's okay, that happens. So I go down the street to another one, and I just walked in. I was like, hey, I just need to buy some detox drink. Our barcode system's not working. I, what? After the 4th store where the barcode system wasn't working, I realized I must look like an undercover cop or a narc or something like that, right? I've had people say if I grow a mustache, I'll look like Ned Flanders or something like that. But so anyways, no one would sell me anything. Okay, I ended up going to GNC in Oklahoma City, and I said, I want to buy a detox drink. And he goes, oh, over here, that's the one in red. Their #1 selling product in the store, $74. Okay, $74. It cleans and it works. The reason people do this, remember, they're not these guys, they're these guys. They know that if they do this, they don't have to deal with any of the confrontation. They don't have to deal with any of the questions you're going to ask them. They're going to be clean. They're going to pass. They're going to move on. Okay? Now, this is actually what it looks like. Validity testing, what labs look for. Have you heard of these things before? Specific gravity, pH, okay, creatinine. Everyone you know how many people go to jail because their creatinine level's high or low? And a judge looks at them and says, oh, you're cheating, you're going to jail. Okay? You take too much ibuprofen, your creatinine's going to go up. Okay? This is basic body function. And so what happens, there's so much wrong with this. Not wrong with this, but this stuff hasn't changed for 30 years. Okay? What's new to the lab world are 2 new things. What they do is labs can now look for acids that your body excretes. Okay? Your body is constantly rebuilding itself. There are proteins that leave your body. They're actually specific proteins that identify when your urethral cells in your urinary tract, in your ureter, is stretched because of a catheter, okay? This is scientific data that can now identify a human body did not produce this on its own. Okay, you see the dots? Well, it's kind of hard in the lower. The way that these reports are done is algorithms identify if it's real or if it's not. Green dot is good, or a green check is good, a red X means bad. The way I explain this to a lot of people, if you squeeze an orange, you expect orange juice to come out, right? That's what oranges do, okay? That red dot or that red X is as if someone squoze an orange right in front of you and blue Kool-Aid's coming out of it, and they're saying that's normal. Oranges don't do that. What did you do to that orange? Okay? Now, if it's a confrontational thing, it's a confrontational thing. But if it's a, hey, let's talk about that. Why are you using something? When you get a red dot or a red X, unless you're getting hooked up to dialysis, you're cheating. Okay? Somebody that's on dialysis, red dot all day long, okay? But you know they're going to dialysis. They've got a medical reason for what they're producing. Here's an actual example of what it looks like, okay? When I was in Alaska, there's a clinic that's probation and parole. And see how on this lady, on her history, I don't know if you can see it, bring it up later. See this right here? Red, 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 red. Okay? Person was constantly cheating, constantly cheating. Red flag for any of you guys, if anybody comes in to do their drug test and they're screaming, I gotta go right now. You know those people? Okay? They got something in them. Because trust me, that much goes in you, it's coming out. They got to go. Okay. It's like giving someone Lasix. They got to go. Okay. But you see this right here, red dot. Also notice that there's nothing caught. Nothing was present. Okay. So technically they passed their drug test on a dipstick or on a screen all day long. This is pass. Okay. However, I know that blue Kool-Aid's coming out of this orange. So this program called and they basically said, hey, she came in screaming again. What do we do? And I just said, well, keep her busy for 2 hours because eventually your kidneys catch up. Okay. And when your kidneys catch up, everything comes out. You haven't just flushed everything. Okay. So they tell this lady 2 hours later, we need to do another drug test. And she freaked out. On the cameras, like full seizure, cops had to be called, everyone's just. And it wasn't like a live webcam where I'm watching it with popcorn and stuff, but it was just, she was not happy at all, okay? So she does a second drug test 2 hours later, and this is what it looks like, okay? Notice how now she has a green dot? So now I know it's real. I got orange juice coming out of the orange, okay? However, 2 hours later, she started smoking. She isn't smoking 2 hours earlier, okay? But now she is smoking. She has amphetamine, methamphetamine, THC, and cocaine in her system. Okay? Now, how does the conversation change from you're doing good, you passed, to this is what's really going on? Okay? I'll tell you her story at the very end of this slide, at the very end of this presentation, because when you help people and you have, I love what everybody's mission is in your ministry and what you're doing. Helping people stumble forward is a lot better than relapsing and kicking them out. Okay? Because when you finally figure out what's going on, that's when the change can happen, but that's also when you know if they really want to change or not, or if they've just been BSing it the entire time. So that's validity. Prescribed medications present. If you use toxicology as a way of tracking what's going on with people, you can change the situation with people. I heard a lot of times there's discrepancy in care. There's discrepancy in care everywhere. Getting into a doctor, getting into a psychologist, or a psychologist, sorry. It's hard. Then the follow-up is even further. If something happens, further, okay? And when you start a medication, a lot of times you got to do the taper. Well, is it working? Is it not working? If it's not working, now you got to taper back down. Then you got to wait to get back in. I mean, these are things that you guys deal with all the time. This is a way that you can actually start looking at things. When we talk about our medications present, I want to talk about metabolism because this is the number one phone call I get. Why is this here, but this isn't here? And are they taking Wellbutrin? Is that why I'm getting meth? Okay, because the internet's going to tell people to say all kinds of different things. All metabolism is what your body does to medications. It breaks them down. Anything that you swallow, okay, anything at all, goes through your intestines to a thing called a hepatic portal vein to your liver, to your bloodstream. Okay? Once it hits your bloodstream, every time it goes to your liver, that medication turns into something else. Circulates through your body, hits the liver again. All at the same time, your kidneys are filtering things. That's why you see different things. So in my mind, I thought this, okay? Here's how I explain metabolism. You guys have kids? Okay, you know when you step on Legos? Okay, and you think, how much did I spend on that Lego? Because now it's in pieces on the floor, okay? If you buy a Death Star Lego, okay, you can tear that thing apart and make one of these. Don't try it. I just threw it on a slide, okay? However, you can take those pieces, break it apart, and make that. They're pieces. They come together, right? All these pieces break down into different things. You cannot do this. You cannot take, backwards. You cannot take that and build that. Right? Those are the stories. I'm taking Wellbutrin, that's why I'm positive for meth. That doesn't turn into that. Okay? Now, different labs, remember I said point of care cup, screen, or confirmation. The first two, who knows? Okay? It's a chemical reaction. You're going to get false positives, you're going to get false negatives. When you do confirmation testing, this is what you can clearly identify. That does not turn into that. To go even further, the stories that people say to judges, I got to sometimes like kick my foot because I'm like, that's not right. Because you can't take that and build that. Okay? But that's what people are getting told on the internet. All you got to do is say this, which is going to turn into this, and that's why I'm positive for that. But when you have the right information, it clearly identifies what's going on, okay? Metabolism is one of those things that you can track. Not only are they taking the same medication all the time, but are they taking medications as prescribed? If it's a PRN, you're not going to see meds all the time. They're taking it as needed, right? But if someone's taking a PRN all the time, it's a good idea to change their lab results. Trazodone. How many people by the raise of hand know what trazodone is? Okay? Programs use it all the time. Do you guys know that right now trazodone is white hot on the black market? It's not controlled, it's not monitored, but it puts you to sleep. If you're high on meth, you need to sleep. Meth dealers are actively buying trazodone from people. Okay? And in the lab world, you can actually see high meth, high trazodone levels because people are self-medicating. Okay? So here's just an example of prescribed medications. This person was prescribed sertraline, trazodone. Okay? That's it. That's all they were prescribed. Now, when you look at it, there's your sertraline. It's present. Trazodone is prescribed, but it's not detected. All that means is they're not taking their trazodone. Okay, you guys know if they're taking it, if they're not taking it, okay? The call that I got on this was Ritalin, okay? Ritalinic acid is not Adderall. It's not, different drug, okay? But people tell you all the time, oh, that's why I got that in my system, taking Ritalin, okay? I just hit the brakes on like 3 jokes right there, that they'll come later, okay? So, right off the bat, you know they are taking Ritalin, and they are taking their sertraline, but they're not taking their trazodone, okay? One of the things that drives me crazy about labs is you get this one report that says what's going on. Now you got to look at it and you got to go through all the previous reports, okay? Which is going to take me to the third thing, the history. Are they actually taking what's prescribed, okay? Let me go through this really quick. The history. I'll click back to that other slide in a second. When you start looking at lab results side by side, it gives you more of a picture of what's going on than anything I've ever found. Because people are going to change from day to day. They're going to react differently. They're going to interject differently. But when you look at lab results on a day-to-day basis, or whenever your policy is of what you're testing for, I want you to see this right here. Bupropion, that's Wellbutrin, okay? Now, if you go from their latest test to their previous test, here's what it says. On Wellbutrin, their levels went from 1,000 to 574, 873, 1,400, down to 332. So are they taking the same dose at the same time all the time? Have you also wondered why some people are so hyper sometimes, but they're taking the same med? There's never been a med change, but they're just acting different. When you start seeing what's going on, it starts to match what you guys are seeing, okay? But it now gives you objective data to chart about, or to tell the therapist, or to tell whoever the doctor is that they're about to go see. Because why keep prescribing something to somebody if they're not taking it, or if they're taking it wrong? They're self-medicating. If they're self-medicating, their treatment is not the same, okay? I want to go back to this slide that we did earlier. So on this one, remember we talked about Ritalin? They called me on this specific test to say, are you sure this is Ritalin? Because this person doesn't do Ritalin. And I'm kind of like, well, there's Ritalin there. That's kind of like saying, they don't cook with red dye number 5. But everything you're cooking's pink, okay? So where are they getting the red dye number 5? So on this one right here, the situation that happened with this is Ritalin. Number 1, why are they on Ritalin? They don't do Ritalin, that's not their drug of choice. But you can see on this test, I didn't include the date, it was probably a week later from this, and even those a few years ago. So you see on this report, Ritalin has never been detected, ever. So why all of a sudden out of the blue did they click down to Ritalin? They've been in treatment for months. Why Ritalin? Out of the blue. Okay, it's a good question to ask the person, right? It's also a good question to tell their therapist about, or whoever program you're working with. Why are they suddenly now taking Ritalin? Because they are ridiculously hyper-focused, okay? The 2 other things I wanted to point out on this, okay, when you start thinking of your patients and your clients, medications do something. And the other thing that I've seen off of all these labs over the last couple of years, one statistic for Beechtree here is they're doing about 18,000 samples a month. Fentanyl makes up 8% of the positives. 8%. okay? Everyone's talking, fentanyl's bad, don't get me wrong, okay? However, do you know what the percentage of non-compliance is with mental health medications? 76%. 76% of people are not on the med they should be on, or they're taking something they shouldn't be on, okay? That is the crisis in and of itself. And when they can't get help to mental health, they'll borrow it from somebody else. When somebody else doesn't have it, they click to their dealer and say, hey, I need something for depression too. And then you got the pharmacy on the street, okay? The interesting thing about this one report, not only is Ritalin a new thing, so something to chart about, that's an event. That is a new thing to chart about and to start tracking. Why now Ritalin? Good conversation on one-on-ones, right? The second thing is look at the trazodone. Not only was trazodone not present on this test, in the history, it has never been detected, okay? With detection windows of 6 days. No, you don't add them together, so say 4 days, okay? So they haven't been taking their trazodone for 4 months, but they get it every night in the program. Where's it going? Okay, now, again, I don't want to accuse anybody of selling, right? You wonder where they keep getting the new iPhones, okay? But why? Why are they still on it if they're not taking it, okay? Here's the third thing, okay? I asked the program, hey, did you just start them on sertraline? I go, what are you talking about? And I said, yeah, 254. Now remember, that's what's measured in this lady's urine. Is that high? Is that low? I don't know. That's what it was. So how is her progress right now? How is she? Like, she's really engaged more. We thought it was the Ritalin. She's remembering more. She's starting to open up more. And I just said, well, did you just start that? Because it's never been detected before. And they said, oh, we just added it this test, but we didn't add it before. When they didn't add it before, it wasn't being looked for. She had not taken sertraline the entire time she was in the program until this test. Once she took this test and we knew what we were actually looking for, then suddenly her level came back at 254. For 4 months, they were charting that she was doing great on sertraline, and it was never in her system. So you know your patients, you know what they should be on, what they shouldn't be on, but you have no idea where else they're going. You have no idea what else they're taking. And when they do go home or they do go on leave and they come back, who knows where they went? It's impossible to know all that stuff. However, when you look at what's in their system, it helps you react differently, helps you work with people, okay? So, is it real? Is what's prescribed present? And what else? Okay, then their history. Now, I just want to go through a few things that are commonly asked questions, and then, because like I said, you put a quarter in me, I can go for hours on this stuff, okay? But there are a lot of misconceptions on methamphetamine, okay? In order to identify methamphetamine, the machines have to identify that this is methamphetamine. It's not Adderall, it's not Ritalin, it's not everything else, it's meth, okay? However, there are different types of meth that I want you guys to be aware of, okay? Anytime, and if your labs aren't doing this, find a new lab, okay? Because there's a lot, this stuff is what goes to court all the time, okay? And I have testifying court all the time on this stuff. Methamphetamine, okay? What happens is the metabolite of methamphetamine is amphetamine. It does not go the other way. You do not have a liver that takes amphetamine and turns it into methamphetamine. If you do, this is my if, you got a magic liver. Okay, and you got a magic liver that creates methamphetamine. If the cartels find out that your body produces methamphetamine, okay, you're gonna get milk dry. So it's just a common, the internet says all kinds of different things. It does not. Methamphetamine does not get created from pharmaceutical Adderall, okay? However, there are two types of methamphetamine. On the slide here, it's kind of behind me. There's two types of meth, D or L. So you can take methamphetamine and isolate it and find out if it's D or L isomer. I don't know if you guys knew that, okay? Here's what it is, D or L isomer. D isomer is street meth. I remember it as danger, D danger, L legal, okay? What happens with street meth is you have no idea what's mixed with it. So you usually see all kinds of other things as well, okay? But the lab can actually identify this. So on the results, what happens is not only does it say methamphetamine, this dark blue right here, where it says methamphetamine, okay? Because methamphetamine's present, your body will convert it into amphetamine, okay? Sometimes people take so much meth but it's been a while, so you'll only see amphetamine. So when people out of the blue have amphetamine in their system and it's not prescribed, chances are they took meth and it's just converted into amphetamine, okay? However, once this methamphetamine is identified, what happens is this second test can be done. Is this D or is this L isomer? Okay? If it's a D isomer, that's street meth. Here's what L isomer looks like. Okay? Yeah. You guys ever bought these? These are side by side at Walgreens. Okay? Side by side. Non-medicated, medicated. Non-medicated are menthol. Same stuff you rub on your chest. Okay? The second kind is levomethamphetamine. L-isomer methamphetamine. If you're using these things, you're going to pop on a cup all day long for meth. Okay? So when you get a meth positive, with whichever you're testing or how you're testing, confirm it and make sure that it's the right meth. Okay? Because sometimes you get people saying, these guys, okay, I'm taking this Vicks inhaler when they're cranking on meth. Okay? So this is happening all the time. And I don't know what your program's policies are of the medications you can be on and can't be on. Add these guys to your list, okay? I'm not going to say add these things. I'm recommending you add these things to your list, okay? Here's the other common thing, okay? Alcohol. Alcohol, there are so many ways of testing positive for alcohol. Okay, and when people say, and they're swearing up and down, I didn't consume alcohol, here's what happens on the 3 types of testing that we've been talking about, okay? Number 1, if alcohol is positive, what that means then is the sample in the cup has alcohol in it, okay? A point of care cup or a dipstick that says alcohol, that means there's alcohol in the urine. That can be, I mean, guys aren't the best aim, chances are they hit their hands and just use the hand sanitizer thing, okay? Or I accidentally sneezed and I spit mouthwash in my urine and that's why I have alcohol, okay? You guys know the stories that you get all the time, okay? However, when you do the 3 types of testing, the instant read is saying that it's present, okay? However, just so you guys know, if you have a client that's diabetic, that's actively in ketoacidosis, all day long they're testing positive for alcohol, okay? Their blood sugar's up, blood sugar's alcohol, okay? That's going to test positive. If somebody has a bladder infection, you're going to test positive on a point of care cup. Bacteria produces alcohol, okay? So someone has a bladder infection, they're going to fail all day. What happens then is in order to identify, is it real alcohol or is it just present alcohol, you have to identify what did the alcohol do. And this is what it looks like. So on the test, on laboratory testing, there's always a test on every sample that they identify alcohol, right down here, okay, IA, that means the immunoassay identified alcohol, okay? Now, this test, what happens is once alcohol is identified, you can have a confirmation done on that alcohol. Right here, do you see this right here that says LCMS? That means this alcohol went through the liver. This is consumed alcohol, and it can be measured. This means they drink the hand sanitizer, they drink the mouthwash, they drink a beer, I don't know what it is. This was consumed. This is what it looks like when it's a false positive. When the cup says positive, the dipstick says positive. What happens is it says down here, or on the lab, whichever lab you guys are using, it will say that the immunoassay is positive, but it didn't go through the liver, which is a great way of talking to your people saying, hey, I mean, there's nothing worse than being accused by the lab, right? However, the lab's reporting what's in the urine. It's hard to paint the picture of what's going on. That's why we want to try and make things easier, okay? But it's really nice to be able to say, no, this was a false positive. Or having the hard conversation of, no, this went through the liver. This was consumed, okay? Here are a lot of questions that I get all the time. THC, okay? Is Delta 8 and Delta 9 available here in Georgia, or is that illegal? Okay. Do you guys know what Delta 8 and Delta 9 is? Yeah. Okay, it's spice. Okay? It's spice. And so what happens then is on a dipstick or on an analyzer, it's going to identify a cannabinoid. Now, point of care cups are labeled THC. It's not looking for THC, it's looking for cannabinoids. CBD tests positive on point of care cups all day long, okay? However, this is something I bought at a 7-Eleven, okay? It's two gummies, and all this is it's just enhanced CBD. But when you flip it over, you can see the ingredients right here where it says 15 milligrams of Delta-9 THC. So this is legal, and you can buy it over the counter, okay? On a point of care cup or on an analyzer, all day long it's going to show up as THC. On a confirmation, it will be isolated as THC. There's reasons people are buying this type of CBD versus regular CBD. If you're buying regular CBD, there's not enough THC in it to test positive for marijuana, okay? Are you high off this stuff? Yes, you will get high off this stuff, okay? The other thing about THC is it is stored in the fat cell, okay? So it will stay around for a little bit. It won't stay around for 4 months, 6 months, okay, 2 years. If someone says, I did use THC, but I'm losing weight, and that's why I'm testing positive. Okay, it is stored in the fat cell. Have they lost weight? Okay, because if someone's staying pretty consistent and they're telling you that story, it's not shedding. It does break down, it does show up. The difference about THC though is it's like, I don't know, it's like cooking with chocolate chips, right? You can cook your cookies and bake it, but then every time you add new batter, but you don't add chocolate chips, eventually there's no more chocolate chips, okay? So if you're gonna test positive for marijuana or THC at, let's say 500, okay? As you're weaning off that stuff, you're gonna see levels dropping, okay? You can't go 2 or 3 weeks without THC and then suddenly be at 952, okay? Unless your body is spontaneously producing THC, which is another thing to live in hiding about, okay? Because you don't want people knowing that. So just think about the basic anatomy and physiology of the body. Your body doesn't create drugs, and your body doesn't build upon what's currently there. Your body is designed to break things down, get it out, keep going, okay? So contact positives. You guys know that exists, contact positives? You guys know what a hot box is? Who knows that can say what a hot box is? In a closed, you ever pull up behind somebody and you can't see any heads because there's so much vape oil or smoke and everything like that? Okay, you can say you're not smoking marijuana, you're gonna get high, okay? You're gonna get positive. I've seen contact positives for THC, for meth, and for heroin, okay? They are super low levels, but that means you're hanging out with people smoking heroin, okay? Pay attention to that. Change your circles. But yes, you can test positive on confirmation. But you also, the levels don't match a lot of use. This is the bane of my existence, poppy seeds, okay, and muffins. Okay, poppy seeds. In order to test positive on a confirmation test, now remember, screens and point of care cups, it's just saying positive or negative, present or not present, okay? In order to consume enough poppy seeds to test positive on confirmation testing, you would have to consume 15 grams of poppy seeds, then be tested within an hour. 15 grams of poppy seeds is like an 8-ounce glass of poppy seeds, okay? You're not gonna have problems with morphine. You're gonna have problems with the toilet later on, okay? You're gonna need a seatbelt if you consume that many poppy seeds, okay? Just to be clear, that's not the story. The other thing that's kind of funny about that too is if you're at risk of losing your liberty, why in the hell are you eating poppy seeds? Okay? That's like kryptonite. If don't touch it. I mean, if you're going to test positive because of a false positive, stay away from it. Okay? Poppy seeds. The other thing that's funny about poppy seeds, okay? You got to realize poppy seeds are cleansed because the poppy seed milk, right? The morphine is the milk around the poppy seeds. So if you're testing positive for buying a Starbucks poppy seed, that's like a class action lawsuit. They're buying poppy seeds from unfiltered Taliban sources, you know? So, I don't know. Let your sarcasm go to 11 with this, okay? You just got to go. Okay. Vape oil. Vape oil. If you have a sealed cartridge where it's a disposable vape, chances are that's what's in that vape. If you have clients that are refilling their vape oil, there is no idea to know what in the hell is in vape oil. I've seen heroin, kratom, gabapentin, Wellbutrin, meth, obviously. And that's because it turns into one of those things. Has anyone here ever bought kratom before at a vape store or at a store? Bought kratom? It was interesting. Is it? Okay. We'll be waiting for you outside. Okay. Kratom, the other name for it is mitragynine. Okay. The crazy thing about kratom, and again, go and see what your clients are buying. Okay. Go buy it. Because when you say, I want kratom, that person behind the counter is going to say, do you want the energy blend? Do you want the sleep blend? Do you want the relax blend? Do you want the pain blend? Well, is it kratom with ephedrine, kratom with melatonin, kratom with their own little blur or their own little blend? So when you look at lab results and you see somebody look at you with that ghost white look of, I don't do that, and you're reading them like they are scared of these results, you know they're not lying to you. It doesn't change the fact that it's in their system. I've had so many people almost go back to prison, and some actually go back to prison because they don't know what is in their vape oil. And when they test positive, it's a violation of their parole. You see it in their eyes like, I don't do that. But at the same time, they're driving from Georgia to North Florida to the cool vape store that has the best product. Okay? They're either these guys that you can say, stop using that vape oil, buy the controlled ones, buy the Juuls or whatever, right? What am I trying to say? The disposable ones, right? Bring them back, or they're lying to you. Okay? It's one of those two. Hair follicle testing, blood work. Here's the, what? I have another hour? Okay. Now I'll wrap it up, okay? Hair follicle testing. In Utah, it's now against the law to use hair follicle testing on DCFS or Children Protective Services. Reason being is because the way hair follicle testing works is you take hair, any part of your body, okay? You add it to a petri dish, chemicals are added, then a reaction is identified, and that chemical reaction dictates what's positive, what's negative. Now with hair, did you use 2 days ago because there's a little bit of growth? Or was it 8 months ago when you were hotboxing with somebody? It's gonna say present, not present, okay? The reason it's outlawed in Utah now, and it's actually starting to be looked at in other states, is because the darker the hair and the stronger the hair, the harder the chemicals break it down. So there's a lot of false positives, okay? And when there's false positives, there's false negatives, which means the darker the hair, the more false positives there are. That's why it's been ruled out for indigenous people or people have darker hair, okay? So blood work, the way that blood work does, like a lot of accidents, you hear police take you to the hospital to get blood work done, okay? What that means is they take the blood, spin it down, the plasma that is used goes on a conformation and it identifies. The difference between blood work toxicology and what we've been talking about with urine toxicology, blood work is a very short window. It's what's in your system right now, okay? Whereas toxicology gives you a swath, one test, you can see what's going on for a week, okay? Same machine programmed to do different things. So again, those are some of the options. And so when people say, well, why isn't this drug here? I did blood work. Well, it's not the same apple to apple. And that's mostly what I want you guys to get out of this. Know what you're looking at so you can compare it to what you need. Obviously, there's any questions. I don't know if I have time because I'm talking. Are there any questions?
How long does it actually take? You said not 4 months, not 6 months, not 2 years, but for THC to get out of somebody's system. What is our option? We just monitor the levels decreasing?
I would just monitor their levels, and if they're constantly going down, then you know that they're not using. But you get to the point where, and again, different labs are calibrated to different things, right? But when you start to see a 500 drop to a 200, drop to eventually it's going to get to that point where it's slowly working out. You might have little bumps, you know what I mean? There's a huge difference between a 65 and a 70 versus a 200 and a 4,000 type of a thing. But they might test positive on a confirmation after maybe like 30 days, 45 days, possible. But on a point of care cup or on a screen, it's hard to say. But just monitor, if you monitor their levels, you'll be able to know they're coming off. Okay, and it's the same thing with people that are doing buprenorphine or Suboxone. People are on that for life at times, and then there are also people that are just using that as a way to get off. And a lot of times when people are tapering, it's easy to get somebody off a high dose to a low dose, but that low dose to off, that's touch and go until they're where they need to be. What? Isom. Did you say? I'm hard of hearing. I'm sorry. Mike Isom. Isom. Can you get meth from sex? So that one was omitted. Okay, so no. That's happened to me in court before. Okay. So think about it. Okay, everyone's scared of fentanyl. Okay, everyone's afraid of fentanyl right now. You cannot just touch fentanyl and get high, unless you have a cut or a blister or there's a way of that fentanyl getting into your system. Okay, or someone does the LeBron James with cocaine, and you walk through it, you're going to test positive. Okay, so, but when you talk about sex, okay, the whole reason that you're going to get a sexually transmitted disease is if there's a barrier that it's getting into. Okay. Now, unless they're figuring out a way to absorb the meth through the vagina or the penis, okay, that's where you can just start looking at the anatomy. Okay. Just say, wow, how's that person doing meth then? Because how did you get it? And what's really crazy, you guys, is basic anatomy and basic physiology. When you really look at it, it's like, okay, so you're smoking meth. Okay. How is that getting down to where you're having sex? Okay, if I'm smoking and then there's oral sex, there's a possibility of a low level, like possibly like a contact. But when you start looking at levels and you really start understanding what's going on, a meth level of 4,000 or whatever is not inducive to that. Yeah. Now we did remember my slide about that lady that cheated in Alaska? Interesting thing about her is they finally caught her after months and months and months of testing. They finally caught her, sat her down, and had the come to Jesus conversation. The hard part was when they said, don't you wish you could be the person that started? Don't you wish you could go back and be that person? And the heartbreaking part of that is she said, I've been a prostitute since I was 12 years old. This is all I know. Okay? We had to take those lab results of her cheating to the judge. Had to talk to the judge, had to talk to the therapist, the parole officer, and the narcotics. All these guys had to go and talk to the judge. The cool thing about the judge, though, anybody that's working with parole and probation, I have just witnessed so many times where you look at these hardcore people that are dealing with this, that the more information they have, the more they will help your clients stumble forward. The more information that they have of, hey, this is what's really going on, let's talk to the judge about it. Because the therapist was able to say, we finally figured out what was going on. Here's our plan going forward. Here's how we're going to work with her. She has no home because she's homeless and she's a prostitute. Okay. So we presented all this to the judge. She is guilty as hell. However, here's the plan. And the judge didn't put her in prison or jail. Sorry. The cool thing about her today is she runs a grocery store in Anchorage, Alaska. She's completely changed around her life. Everyone's got different stories. Our prayer for you guys is just to keep your heads up with what you're doing. This is information that can help you guys treat better and also have those hard conversations without making it hard. It's just data that helps people get off that horse. I appreciate the time being here, and I hope it helps you with your clinical practice, and pray for you guys. Love you. Thank you.